Vagina. This is a muscular fibromuscular tube that connects the external genitalia to the uterus. It serves as a passage for the menstruation, sexual intercourse, and the childbirth. Anatomy of the vagina. Length approximately 7 to 10 cm long, extending from the vaginal orifice to the cervix. Orientation. Positioned posterior to the bladder and urethra and anterior to the rectum. Vaginal fornices. This is around the cervix, including the anterior fornix, shallow, posterior fornix, deepest related to the recto-ureterine pouch. Lateral fornices, right and the left. Histology of the vaginal wall. The vaginal wall consists of the four layers. Mucosa, non-keratinized, stratified squamous epithelium, provides protection. Contains a glycogen which supports the lactobacilli. Normal flora. Lactobacilli produce a lactic acid, maintaining the low pH 3.5 to 4.5 to prevent the infection. Muscular layer. Smooth muscle for the flexibility and the contraction. Adventitia. Connective tissue with the blood vessel, lymphatic and nerves. Functions of the vagina. Sexual function. Facilitates the intercourse and the sperm transport. Menstrual function. Passage for the menstrual flow. Birth canal expands significantly during the childbirth. Protection and strict pH prevents the infection. Blood supply, nerve supply, and the lymphatic drainage. Arterial supply. Vaginal artery, branch of the internal iliac artery. Venous drainage. Vaginal venous plexus, internal iliac vein. Nerve supply. Pudendal nerve, somatic and the autonomic nerve, pelvic plexus. Lymphatic drainage. Upper vagina, internal and the external iliac nodes. Lower vagina, superficial inguinal nodes. Clinical condition related to the vagina. Vaginitis, inflammation due to the infection. Example, bacterial vaginosis, candidiasis, and the trichomoniasis. Atopic vaginitis, vaginal dryness due to the estrogen deficiency, common in the postmenopausal women. Vesica vaginal fistula, abnormal connection between the bladder and the vagina, causing the continuous urine leakage. Rectovaginal fistula, abnormal connection between the rectum and the vagina, leading to the fecal leakage. Vaginogenesis, congenital absence of the vagina. Meyer-Rokitansky-Kuster syndrome. Vaginal carcinoma, rare, associated with the HPV infection or the previous diethyl stilbestrol exposure in the utero. The vagina is a fibromuscular tube extending from the vaginal orifice to the cervix, lined by the non-keratinized stratified squamous epithelium rich in the glycogen. Lactobacilli maintain the acidic pH 3.5 to 4.5 to prevent the infection. Posterior fornix is the deepest part and related to the recto-uterine pouch of Douglas. Upper vagina drains into the iliac lymph nodes. Lower vagina drains into the superficial inguinal nodes. Common infection: bacterial vaginosis, Pichyode, Candida, itching, white discharge, trichomoniasis, frothy grain discharge. Atopic vaginitis occurs in the postmenopausal women due to the estrogen deficiency. Vaginal carcinoma, this is rare but associated with the HPV and DES exposure. Fistula, vesica vaginal, rectovaginal, can occur after the prolonged labor or the pelvic surgery.